Let's dive right into the structural biology of facial aging in this explainer. We're going way beyond skin.
I just look tired. Patients say this constantly, unable to pinpoint exactly what changed over the decade.
It's not your skin, it's a literal structural engineering failure driven by these four specific biological culprits.
Let's start with the foundation. As we age, our facial bones literally recede, collapsing the entire scaffolding.
This bone loss starts surprisingly early, but progression diverges drastically based on your gender and hormones.
Men see a linear structural decline. Women, they hit a sudden, precipitous cliff right after menopause. Because of this, maintaining estrogen through HRT becomes biologically crucial for preserving female facial bone density.
What's really fascinating is how that bone loss triggers a devastating anatomical cascade in the soft tissues.
A youthful face has about 11 distinct, robust fat compartments per side. They provide essential structural padding.
But by our late 60s, the vast majority of these compartments undergo dramatic, volume-depleting atrophy. Next up, the osteocutaneous ligamentous network. These are the rigid anchors attaching your skin to that receding bone.
As bones retreat and fat shrinks, these static ligaments forcefully tug the skin inward. It's pure mechanics.
This specific mechanical tension is exactly what creates those deep facial folds and visible under-eye bags.
So here's a crucial question. Why does our facial fat shrink while visceral belly fat expands? It's the cortisol contradiction. Chronic stress is anabolic below the neck, but heavily catabolic to facial volume. Cumulatively, intense stress, yo-yo dieting, and midlife hormone shifts rapidly accelerate this localized facial fat atrophy.
The big takeaway? Biologically, facial fat is completely different from abdominal fat at a deep cellular level. Surgeons see this firsthand. Different facial fat pads literally possess completely different physical colors. These color variations reflect beta-carotene levels, which dictate exactly how these cells handle systemic stress and inflammation.
This is precisely why abdominal fat grafted into the face stubbornly retains its original genetic source code.
If a patient gains weight, that grafted abdominal fat will unexpectedly hypertrophy right in their face.
So, if facial aging is driven by bone, hormones, and stress, is anti-aging fundamentally an inside job?